Hello everybody. Hamza Myatt of Hamza's Den has released a video aiming to disprove the notion that Muhammad could have been mentally ill. He starts off by explaining that as atheists don't believe in devils or spirits, they state that Muhammad is either lying or he was mentally ill. In this video he tries to counter the latter claim.
The other claim of the atheist to try to explain this phenomena of this experience that the Prophet Muhammad had in the cave 1400 years ago is he was a crazy guy. If this guy thought angels were speaking to him, then he must have been suffering from some kind of mental illness, because angels don't exist. So if he's claiming an angel speaking to him and he truly believes an angel speaking to him, he must be crazy. So this is what we're going to deal with today. So to help me solve this problem, solve this riddle, or to explain the situation, I'm bringing, mashallah, someone with credential who is qualified to speak on the subject of mental illness. So he'll know the symptoms of mental illness, the ramifications of mental illness, to see whether or not this is a justified claim that the Prophet Muhammad was suffering from mental illness. So mashallah, we have Dr. Abu Isa, who is a senior consultant for addiction and child adolescent psychiatrist. So this is his title. Dr. Abu Isa is a practicing Muslim who believes in integrating therapeutic interventions from the Quran and Sunnah with the Western understanding of psychiatry and mental health. He works collaboratively with mashayikh and students of knowledge like Ustad Tim Humble on complex cases that require a combination of ruqyah, psychiatric interventions. His expertise includes working with individuals who have been affected by jinn possession and magic. He works with people who have experienced trauma and uses trauma-informed care to help people overcome their crisis. So this is the qualifications, this is the experience, this is the credentials of the man who is going to, inshallah, do a presentation to us as to why mental health could not be an explanation for the claim of the Prophet Muhammad 1400 years ago in the cave of Hira.
So Hamza has given a very good introduction to the specialist. However, given his mixing of professional and religious roles, there is cause for concern over how objective he would be. But let's hear what he has to say.
Here he is. Salaam alaikum, akhi.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
So, mashallah, I think the format of this, you're going to do a presentation. You've got slides, you've got videos, you've got all these kind of things that are going to go to conclude what we believe to be true. And then afterwards, inshallah, we will do a Q&A. We'll open up the stream, we'll put a link up, and we'll bring people on if they've got any questions and such.
Okay. I think the stream today is going to be a game changer, because this claim about the Prophet ﷺ having a mental illness, I have seen this. And to be honest, this is one of the main reasons that I started my YouTube channel about a year ago, because people with no qualifications, I've not seen a psychiatrist or a neurologist make this claim. It's kind of lay people, usually ex-Muslims, with very superficial, if zero knowledge of mental illness, psychopathology, neurobiology, and making these claims that the Prophet ﷺ was hallucinating or was delusional. So I wanted to challenge that. And I think today, inshallah, this is going to be very good, very informative.
There are some excellent videos that try to look at the mental health claims regarding the Prophet Muhammad. These have been produced by Abdullah Gondal and Abdullah Samir. Contrary to what Dr. Abu Isa says, they do feature medical professionals during these videos. I won't be looking at every possible mental health claim, just respond to the claims that are made in this video. I should point out that although I am a medical professional, I am not a consultant psychiatrist, but I have worked in psychiatry. I feel able to question anything that Dr. Abu Isa says, and I will back that up with evidence.
Okay, so the two claims that are made by ex-Muslims or atheists are that either the Prophet ﷺ was psychotic. So the picture on the left with the multiple faces, this is a diagrammatic or graphic representation of schizophrenia. And the other one on the right is epilepsy, which is quite interesting because epilepsy is actually a neurological condition and not a psychiatric condition. So those who claim that the Prophet ﷺ, when he was receiving revelation, was actually having epileptic fits, so they need to distinguish that this is a neurological condition. Yes, you can have mental health conditions or symptoms associated with epilepsy, but this is something that for people should be clear that schizophrenia, psychosis is a mental illness, epilepsy is a neurological illness.
So he has barely got into his presentation before I've had to stop and correct him. He stated that epilepsy is a neurological condition and not a psychiatric condition. He makes a brief mention that you can have mental health symptoms associated with epilepsy, but doesn't explain that it is actually quite common and that studies have shown that up to 50% of patients with epilepsy developed psychiatric disorders. So a claim that he had epilepsy does carry significant concern that psychiatric disorders are also present.
And mental illness has clear definitions, okay?
For brevity, I have cut out this part. Please pause the video and read this slide.
Within mental illness, we've got something called severe mental illness, okay? And severe mental illness includes schizophrenia, major depression, and bipolar disorder. This is two classifications we use in mental health. And what's really interesting is that basically the history of psychiatry is very interesting. The classification of mental disorders began with two Frenchmen in the 1800s, and then that kind of developed into these classificatory systems. So with respect to DSM, it was first introduced in 1952 after the US military decided that they needed to have a classification of mental disorders. And what was, Hamza, you'll be surprised with this. So homosexuality was actually defined as a mental illness by DSM. And only in 1973, when they had the third revision, because of social pressure in the US, the movement for homosexuality was kind of gathering pace. They removed that from the classification. For brothers and sisters, it's important for you to realize that the classification of mental disorders is very fluid, and this is why they do revisions every couple of years because they remove diagnoses, they add diagnoses, they revise diagnoses. So it's a very nuanced discussion, which is why when people claim, "Oh, the Prophet ﷺ had a mental illness," this is a very kind of illogical and irrational statement without follow-up justification. Okay.
This is an interesting point. The classification of psychiatry is revised regularly to ensure it keeps abreast with scientific developments. The general trend is for more new psychiatric diagnoses to be made given better understanding than diagnoses removed from the classification. This makes it more likely that a historical figure would be diagnosed with a mental illness from today's criteria than from that of the past.
Hallucinations and delusions are merely descriptions of lived experiences. So they do not, in and of themselves, denote a mental illness. Okay, so they have to be accompanied by problems in your functioning. So you can't sleep, you can't eat, you have interpersonal problems, you can't go to work. So those symptoms in themselves don't denote a mental illness. So far, what people say is that the Prophet ﷺ had hallucinations. Okay, if he had hallucinations, but then did it affect his functioning? If you believe that.
This part needs some clarification. People with a mental illness, such as schizophrenia, can have hallucinations and delusions, and if the overall condition is not too severe, they can lead a functioning life. This includes people who lived before the advent of modern treatment. In this list of historical people with a strong suspicion of schizophrenia, you can see that they still managed to make notable achievements in their fields. The fact that somebody was able to function in life does not rule out a psychiatric disorder.
So now, if we go through those causes, the Prophet ﷺ never used drugs or alcohol. Okay, there's no evidence that he had a traumatic brain injury. There's no evidence that he had any family history of psychosis. So we can exclude those risk factors. Okay, so essentially, what people are claiming is that he was schizophrenic. And inshallah, as I proceed, I will show why he was not. That was not the case.
Let's address these points he just made. Here is a still from the presentation from the two Abdullahs that provides evidence of Muhammad's mother hallucinating, which is a form of psychosis, so there is a positive family history here. She reported hearing voices and getting visitations from the wives of earlier prophets. At the time of her pregnancy, there was an outbreak of disease in that area. Prenatal and perinatal infections are a risk factor for the development of schizophrenia. A traumatic brain injury can include lack of oxygen at birth, known as birth asphyxia. This could have happened as shown here. Long-term effects of birth asphyxia include schizophrenia and other psychotic disorders and also epilepsy. So clearly the risk factors for schizophrenia and epilepsy were present here.
This will help summarize what I've just said. So schizophrenia has positive symptoms, has negative symptoms, and has cognitive or symptoms related to your thinking. So the positive symptoms are hallucinations, which I discussed, delusions, disorganized behavior in speech. Inshallah, the next 2 or 3 slides I will focus on this. So patients who have schizophrenia, they have something called formal thought disorder. What that means is that their thoughts are all jumbled up and their speech becomes incoherent. Then as you develop schizophrenia, as the years go by, you develop negative symptoms, okay? That including apathy, so they become lethargic, anhedonia, which is loss of interest, the affect, the mood becomes blunted, and they have poverty of speech. Again, this is really important, speech, because the Quran is a recitation. So individuals with chronic schizophrenia have poverty of speech. You can't really communicate with them. They're very kind of usually mute or very limited speech. And then you have cognitive symptoms, which are thought disorders and bizarre behavior. Okay. All right. So this is the negative symptoms. So affective deficit. So you lack facial expression. There's lack of interest in socializing. So the Prophet ﷺ, when he started his preaching, people started joining him. People started accepting Islam, and gradually the numbers of the Sahaba grew. So if the Prophet ﷺ was schizophrenic, how was he able to overcome this lack of interest in socializing? Because he put himself in danger. He used to go and communicate, like he went to Taif, he went to give da'wah. So somebody who has a psychotic illness is not able to function and is not able to relate to other people and communicate effectively. Okay. And that's the next point, mentions communicative deficit, so lacking in speech and lack of motivation. Patients who have schizophrenia have disorganized speech. What is that? Okay. So sometimes it's called word salad because of the way the words are arranged. The speech of a person with schizophrenia often follows grammatical rules, but the content makes little sense. Okay. I'll let people think, is it possible that the Prophet ﷺ had schizophrenia, when you actually see an individual who has schizophrenia and has disorganized speech and you can't make a sense of what he just said?
As I said earlier, in milder schizophrenia, the symptoms do not result in a total loss of function. Not everybody with schizophrenia is committed to an asylum. Look at the list of people here with probable schizophrenia. See how many of them are poets or composers or writers. In schizophrenia, there are episodes of psychosis interspersed with times of normal functioning.
Dr. Abu Isa, what was John Nash suffering from? John Nash, sorry, I don't know who John Nash is. Sorry for my ignorance.
Let's answer this question for him. John Nash was a very influential and prize-winning mathematician who had schizophrenia. This shows that very successful people can have schizophrenia, so his presentation is wrong in this case.
If we are to believe the allegations or the claims by people that the Prophet ﷺ had a mental illness, we have to believe he had a mental illness and also that it was not treated. So how is it possible for him to have an untreated mental illness and achieve everything that he achieved?
Antipsychotic medications are the mainstay of treatment of schizophrenia in modern times. In the past, there were other less successful treatments. Some people with schizophrenia, especially those with a good social support network, can cope without medication, especially if it is a mild condition.
Stigma. This is another evidence I'm going to use to prove that the Prophet ﷺ was not mentally disordered. Why? Because stigma, what is stigma? Stigma is basically negative perceptions towards people because of the condition they have. So if the Prophet ﷺ had a mental disorder at a time which was 1400 years ago, where you would hypothesize that stigma was more of an issue because now we have better awareness of mental illness, then how come he wasn't ostracized by his society?
This is a rather weak claim, as the stigma is actually more of a modern attribute caused by a greater understanding of mental illness. In the past, it was indistinguishable from being possessed by spirits or being in contact with spirits. Muhammad was offered medical help and called crazy by the Meccans.
So I've covered schizophrenia and psychosis, and I'm going to cover now quickly epilepsy, okay? Because this is one of the other um, allegations or claims that people make, that the Prophet ﷺ had epilepsy. So what is epilepsy? So people who claim that when the Prophet ﷺ had revelation, when he received wahi, he was actually having an epileptic seizure. It's extremely illogical, because all of the evidence, both clinical evidence, anecdotal evidence, and also research evidence, shows that people who have seizures do not remember what happened during that seizure. Okay, so memory is significantly impaired. Patient's memory of seizure is almost always fragmentary. Okay, and I've underlined that there's complete recall of a seizure is almost never obtained. So I think it's very clear that patients who suffer from epilepsy have pretty much no memory of what happened, even kind of during the seizure period.
Here we have evidence of Muhammad, who could have been having a seizure when the people at the time thought he was being affected by magic, and that he used to be forgetful of things.
So if the Prophet ﷺ had a seizure when he was receiving revelation, how was he able to produce the miraculous Quran in terms of its linguistic beauty?
This slide demonstrates changes that are consistent with Dr. Abu Isa's description of symptoms during a seizure. It's important to note that people with epilepsy do not suffer from the symptoms all the time. In between their seizures, they can lead a normal life, sometimes a high-functioning life where they can be extremely creative.
So this hadith mentions that people at the time were aware of this condition, epilepsy. Okay, so actually the Sahaba brought this lady to the Prophet ﷺ. So again, the question would be, if people are aware of epilepsy, then why did they not? Why did the Quraysh not say that the Prophet ﷺ has epilepsy, and this thing that he's reciting during epilepsy is nothing but a figment of his imagination and a product of his epileptic fit?
Again, the two Abdullahs debunk this poor line of reasoning by explaining that at the time epilepsy was considered to be due to jinn possession, and that is why this lady sought Muhammad's help. In summary, Dr. Abu Isa didn't adequately explain that there can be a range in severity of mental illness, and he has shown the more extreme cases in a way to imply that most sufferers are like this and cannot function, and therefore Muhammad could not have had this illness, when it is possible that he had a milder form of these mental illnesses. We cannot be certain whether any historical figure had a mental illness. The aim of Hamza's video was to debunk the claim that Muhammad had a mental illness. From analysing the information here and from outside sources, I can conclude that this video does not debunk that claim. Thank you for watching, and please let me know what you think in the comments section.